So my name is Katie Geelan-Hansen, and I'm an assistant professor in the Department of Otolaryngology, Head and Neck Surgery, and I have specialty training in facial plastic and reconstructive surgery. I went to medical school at the University of Iowa, and after completion of medical school, I went to the Cleveland Clinic where I finished a residency in otolaryngology, head and neck surgery. After completion of my residency, I actually worked as a general otolaryngologist for a few years, both in a private practice as well as in an academic setting. After working for a few years, being able to do sort of the entire scope of ear, nose, and throat, I found myself becoming more and more interested in facial plastics and reconstructive surgery. And so I actually decided to do a fellowship which I completed at the University of North Carolina in facial plastics and reconstructive surgery. I initially picked my specialty because I enjoyed the variety of conditions. So some of the common conditions that I see are those that involved perhaps breathing through the nose, or maybe some external changes to the nose or to the face, eyelid surgeries, skin cancer repairs, trauma to the face, in terms of any sort of bony trauma as well as soft tissue trauma, and other aesthetic surgeries as well. In addition to that, I also like the fact that we could treat people in all stages of life, including newborn babies to people in advanced stages of life. When people come to visit me, what I want to do is I first want to make them feel comfortable. I want them to feel comfortable with me. I want them to feel comfortable in my office. I want to listen to them, and I want to thoroughly understand what it is that concerns them and why they would come in to see me. I also want them to be thoroughly informed and educated as to what it is that we're talking about, the options that we have to treat their concerns. Academic medicine is appealing to me because it allows me to be in an environment where there's people who are learning, and with people who are learning, and there's a certain amount of energy that goes along with that. I also enjoy being in academic medicine because there tend to be more complex cases that come into academic centers, and it gives me the chance to collaborate with other physicians in other specialties, or even within our own specialty, in order to provide the best care for the patients.